Yes, of course. My name is Lannoo. I'm working at University Hospitals of Leuven at the service of abdominal surgery, and I'm a bariatric surgeon, so I do surgery um, to take care of people who are living with obesity. So, to name it exactly, we do surgery on the stomach and the small bowel to induce weight loss, and most importantly, to cure the comorbidities of obesity, like, for example, diabetes, sleep apnea, hypertension, and dyslipidemias.
Yeah.
I'm also a member of the board of the BESOMS, and the BESOMS is the Belgian organization, um, Belgian section of metabolic and bariatric surgery. So that is an organization that all the professionals who are taking care of bariatric surgery and of the patients gathers together. And it's from that organization that we had the idea that a registry where we register the patient data who underwent such kind of operations, to register their outcomes and the kind of surgery they had.
Maybe you can align a bit or elaborate a bit on the why there is a need for data.
Yes, so the why for data is, in fact, a lot of reasons why it became more and more important that when you are a doctor or you are working in healthcare, that we need data from, in the first place, from the things we are doing, but also in the second place, how patients are experience those that care that we give to patients to make their lives healthier and better. So, first of all, you all know that healthcare costs a lot of money. How can you make healthcare better at a lower cost? It's very important that you have a constant monitoring of the health outcomes, of course, of what you're doing, because it's obviously not fair to reduce costs at the cost of the patient. It's very important that you have the data who tells you almost real time, I should say, that what you are doing has no harm for the patient.
Yeah, you're talking here about surgeries and obesity. Of course, the obesity pathway is a long trajectory, which is lifelong, in fact, where surgery is just a limit in time. How do you deal with that situation to make sure that you capture all events related to those patients?
Um, we have, I must say honestly, we already had a lot of attempts to keep a registry, and from the past and from the failures, I learned that it's very important that the bias on the data is as low as possible. And then what's also very important is that, of course, that the data you want to have, that you have it from as much as patients as possible. You start with a rather limited set of data you want to keep, but that you look for possibilities to have all the data, then to start with a lot of data entry points and end up with nobody who has filled them in because the task is too much. It's also very good, and certainly when we are talking about also not only data that can be delivered by the healthcare professionals and the hospitals, but also by the patient, you need data, because patient-reported outcomes become more and more important. Then it's very good that you have also patient applications where they can easily fill in their data, where they're easily forced to do that on a very consequent way. So the capability of a registry to connect with other databases will be also very important, because in healthcare, a lot of different databases exist, of course, and it's very important, certainly when you look at the comorbidities of obesity, like diabetes, that you can connect with a registry that keeps outcomes from patients suffering from diabetes, for example. And also, I find it very important, as surgery is not a standalone therapy of obesity, that you could also immediately implement additive therapies that patients do. That we had a lot of partners in the past, and now we are hopeful because we now work with you guys, move up. And I must say, yeah, you have already established some necessary things we need. You have patient application, you know how it works, you know how it connects. On the other hand, you have connections with the government and databases there, and you have the know-how to set up a registry, of course. So I'm very hopeful for the future that now we will succeed to distillate the patient's life, medically, I mean, yeah, in a set of data. And that every surgeon at every moment can see how good he takes care of those patients every day. And that's also something you already have a lot of experience in, how you report at real time, how your medical practice is performing.
Okay, excellent. That's a very clear story, Professor Lannoo. Thank you for this, and
No
thanks
problem.
from the audience.
Okay.
Have a
Thank
nice
you
day.
all.
Bye-bye.